To AFD TV. I'm Dr. Steve Samudrella with America's Family Doctors, and today we have our special guest, Dr. Aaron Millstone, Associate Professor of Pulmonary and Critical Care Medicine from both Vanderbilt University and Williamson Medical Center. Dr. Millstone, welcome to AFD TV.
Thank you. It's good to be here.
Great. Today we have our first question from our viewer. Our first question is from Sarah from Smyrna. What is good quality sleep, and how long should I be sleeping?
Well, Sarah asks a very important question, and that is, what constitutes good quality sleep? In my mind as a physician, good quality sleep means that you go to bed at the same time every night, try to wake up at the same time every morning, and that when you wake up you feel refreshed, ready to tackle the day. No fatigue, no sleepiness when you're talking to friends or family, when you're at lunch or after lunch, and most importantly, that you're safe to drive after a good night's rest. Good quality sleep means that you wake up in the morning and really feel like you've had restorative, sound, safe sleep.
Great. Our next question comes from Jacqueline in Nashville. My husband snores loudly at night. How do I know if he has sleep apnea?
Well, Jacqueline, it's interesting that most of the time when I see patients for evaluation for sleep apnea, it's not typically because the patient made the appointment. It's usually because the patient's bed partner made the appointment. And so there are certainly risk factors for sleep apnea. Historically, patients that are overweight or obese are at risk for sleep apnea, although you do not have to be overweight to have sleep apnea. In addition, a thick neck circumference or a large neck also puts you at risk for sleep apnea. Or if you've had jaw or sinus problems in the past, you may also be at risk for sleep apnea. Typically, patients with sleep apnea will wake up in the morning and feel as if they never went to bed. They're tired by day, they have excessive daytime sleepiness, and they're at risk for having motor vehicle accidents. You may or may not snore. Snoring is classically associated with sleep apnea, but there are plenty of patients out there that have sleep apnea who do not snore at night. So those are a few good rules of thumb for Jacqueline.
Aaron, tell us about the modern treatments for sleep apnea.
Well, there are great new modern treatments for sleep apnea. Perhaps all of us are aware that the mainstay of treating sleep apnea is a device called CPAP, or continuous positive airway pressure. And what this is that this is a small device, usually about the size of a book, that delivers pressure through a hose that comes up to your nose, and that pressure helps to splint open the airway to prevent sleep apnea from occurring. The device has gotten smaller and smaller over the years, and now it's very comfortable. It goes in through the nose. We used to use a full face mask. Now we don't do that as often. There are also new surgical treatments for the treatment of sleep apnea, and these are minimally invasive surgical techniques that it can be very, very effective for patients with this disease.
Great. Thank you, Aaron, for joining us for these past few weeks on AFD TV. To all our viewers, as always, if you have any questions on sleep apnea, please call or email us or make an appointment. We'll be happy to see you. Stay tuned. Next week we will be talking about safety in the sun. From all of us at AFD TV, wishing you a happy and healthy week.